For those of you who have joined us, if you have access, or you should, depending on your computer, you should have somewhere on your screen where it'll say view. And we'd recommend that you just kind of click on that and put yourself into the speaker view. That way you'll see Amy when she's talking, or me right now. You should all be seeing her presentation as well on the screen. And there'll be time for questions and answers at the end. If you have an immediate question that you want, or if Amy asks for questions, you can certainly go to the bottom. There's a reaction tab and you can raise your hand. And then we can get those questions. Otherwise, if they can wait, we can have a question and answer period at the end. Just let everybody know that we are recording this, so this presentation will be on our website in the not too distant future. So people, if they miss something and they want to go back, or they want to tell their friends about it, well, I know a lot of people couldn't make it tonight, or won't necessarily see this one live, but they'll be able to check in later, and we'll have it there for you. Just to get started real quick, I'll introduce myself. My name is Edwin Mailheisen. I'm a physical therapist, and I'm the Director of Rehab Services and Community Wellness at Arbor Health. And this is our first ever Wellness Week and presentation, and so we're excited to start and have some presentations for you. We wish we could do this all in person, but under the circumstances, we decided we'd do some virtual programming and then record it so people could see. So anyway, I'm going to go ahead, just for time's sake, because we want to value the people who are here and your time. We're going to go ahead and get started. I think we're about at 6:03. So I'm going to turn the time over to Amy, let her introduce herself, and then we'll get started.
Awesome. Thanks, Edwin. So like Edwin said, just to echo that, we're really excited to be participating in our first ever Wellness Week. Thank you for participating in our first event of the week and our first virtual event. And everything is virtual this year, but thank you guys for being here. So today's topic is knees and skis. Working on advancing my PowerPoint. There we go. Okay, so quick intro to myself. My name is Amy Ballard. I'm a physical therapist over at Arbor Health Morton Hospital. I work on the inpatient and the outpatient side, and I love skiing, and so I wanted to do a presentation about skiing and injury prevention. My home resort is White Pass, and Arbor Health Morton Hospital is the closest hospital to White Pass on the western side of the Cascades. And so for today's agenda, we'll be discussing knee anatomy first, followed by knee kinematics, knee injuries, and then prevention of injuries. And so we're first going to talk about just the general anatomy, focusing on the knee. So it is two separate joints. You have your tibiofemoral joint and your patellofemoral joint. So tibiofemoral joint is a bicondylar modified hinge joint. So what that means is, I don't know if you can see my cursor on the screen, but there's two articulations of the femur on the tibia, and then the patellofemoral joint is just where the kneecap interacts with the femur. The knee has very poor bony stability and relies heavily on soft tissues, including muscles, tendons, ligaments, and the meniscus. Continuing on with the collateral ligaments, your MCL, or your medial collateral ligament, has an attachment from the femur to the tibia and also attaches within the medial meniscus. And then your LCL goes directly from your femur to your fibula, and there is no meniscal attachment there. And so both collateral ligaments, your LCL and your MCL, are taught in knee extension and external rotation. Going on from the collaterals to the cruciate ligaments, your anterior cruciate ligament, right, I don't know if you can see my cursor right here, is the key ligament of the knee. It's made of two different bundles of fibers that create one ligament, the anteromedial band, which is taught in flexion or tight in flexion, and then the posterolateral band, which is taught in extension. And so I have my handy little knee here that I took off of our skeleton we lovingly named Skelly. But the ACL, I'm going to detach this. The ACL restrains anterior translation of the tibia on the femur. So it's preventing the knee from doing this. And then the PCL, the posterior cruciate ligament, restrains posterior translation of the tibia on the femur. So the opposite. So if the ACL is restraining this motion, PCL is restraining this motion. And so the cruciate ligaments, their goal is to resist extremes of all motions. And we'll talk a lot more about the ACL later. Moving on to the meniscus. The meniscus is essentially the cushion of the knee. It reduces compression across the tibiofemoral joint, provides lubrication. It helps guide the bony movements of the knee and provides feedback to the central nervous system. So the meniscus plays a big role in proprioception, which we'll talk about later. As you can see here, here's the meniscus. 50% of ACL tears also involve a meniscal injury. And as we talked about earlier, the medial meniscus also, because their fibers intertwine with the medial meniscus, MCL injuries are also associated with meniscal tears. Blood supply to the meniscus is not very good, and it's mostly along the periphery. And so meniscal injuries are treatable, but often just don't heal the best because they don't have great blood flow. Moving on to knee kinematics. So how does the knee move? So a lot of people think the knee just does flexion and extension, like we talked about, but it actually has 6 degrees of motion during dynamic activities. So the knee has 3 rotations. So you have flexion and extension. Then you have external, my timer, one moment. You have internal and external rotation of the knee as the tibia and the femur twist a little bit on each other. And then you have varus and valgus angulation. So varus is when the knee bends out, and then valgus is when the knee bends in. The 3 translations of the knee are you have an anterior and a posterior glide, like this. And obviously these are exaggerated movements. You have a medial and lateral shift of the knee, and then compression and distraction of the knee. So moving on to the different types of movement in the knee as well, you have open chain versus closed chain movements. Open chain movement is when the tibia is moving on the femur. So actions like kicking a ball, using a leg extension machine. And then closed chain movement is when your foot is planted and the femur is moving on top of the tibia. So things like squatting activities or skiing. Okay, moving on to our large section on knee injuries. So there's all kinds of ski injuries that we can talk about, head trauma, arms, but today's going to focus mostly on the lower extremity and mostly on the knee. One thing I found really interesting in doing some research was that the introduction of releasable bindings has actually decreased the rate of leg fractures in skiing by 90% in 30 years. So when we talk about releasable bindings, people might be a little more familiar with a DIN setting. You set your DIN on your ski much lower if you're a beginner. So if you take a weird angle, you pop out faster. And then you set your DIN higher if you're a more aggressive or advanced skier. And so while we talk about this, we also can't forget about knee sprains, ACL tears, and MCL tears. They are on the rise as well in comparison at least to fractures. So fractures have gone down, but we still see a lot of sprains and strains. One of the contributing factors to this recently has been the advent of fat skis or powder skis. There's a wider platform under your foot that leads to a greater twisting and greater torque on the knee, which we'll talk about later. And I've got some really interesting pictures on that. And then typically the non-dominant leg is injured more frequently than the dominant. Okay, so back to this picture that we're familiar with now of the knee. Regarding common lower extremity injuries, we often see MCL sprains or tears, ACL tears, meniscal injuries, which we talked about are often associated with either ACL injuries and MCL injuries, patellar dislocations, And then the general soft tissue injuries like muscle strains, and then fractures, which are less common these days, like a fibular fracture, tibia, talus, which is on a part of the ankle, and then femur. So the first most common ski injury is the MCL sprain or tear. These are typically treated conservatively and without surgery. So when we talk about conservative treatment, we usually mean something like physical therapy where there's nothing invasive happening. The MCL is often torn when you're in a snowplow position, often referred to as pizza, as you can see in these pictures. This is much more common among beginning skiers and intermediate skiers when they don't quite know how to stop appropriately and they're still relying on that. They're still working on the pizza French fry technique. The second most common lower extremity injury is the ACL tear. This often does require surgery, but not always. And you'll see more and more these days. There's some really interesting research with ACL tears where they do conservative rehabilitation without surgery, and people do pretty well. The two ways the ACL is most often torn in skiing, get my handy dandy skeleton back out. The first one is landing a jump in poor form. So landing with your weight too far back, and then the back of the boot pushes on the calf. So some people say they're skiing in the back seat. So they're sitting too far back. They land a jump. The back of the boot pushes on their tibia as their bottom brings them back. And so the tibia is moving anterior in relation to the femur. And then also trying to stand up to prevent an unavoidable fall. So your weight is going to one side or the outside of one ski, and your arms and trunk rotate away from that leg. So for example, if you stand up and you start to fall to your right and your skis are still going forward, that, for example, your right leg is planted and you're going forward, and then you rotate away from that. And then if you're doing it to the left side, you're rotating. So one of the tips for that is just accept an unavoidable fall. Try not to twist away from a fall and go with the momentum of that fall. ACL tears, a common mechanism of injury is strong activation of the quadriceps muscle over a slightly flexed knee, which is skiing in general. You're using that knee, or you're using those quads all the time. And then it's often that valgus force combined with external rotation of the femur over the planted tibia. So like we talked about earlier, if you're standing, oh no, I'm falling, your ski's going forward, you're twisting away. And so that's putting a lot of torque and tension on the ACL. It's estimated about 17,500 skiers tear an ACL each year. And if you're a skier, you probably have a couple friends that have, if not yourself. ACL tears account for about 1/3 of all skiing injuries, but there are other ways to tear it as well, such as in a hyperextension injury. But most of these ACL tears are non-contact, so it's not necessarily people running into anything or hitting a log or a stump. It's just people twisting a weird way or landing a strange way that's putting a lot of tension on that ACL. So because ACL is such a prevalent injury within skiing, what are some of the risk factors? So far in skiing, there's not really a clear ratio male to female who tears their ACLs more. It's about 50-50. With the person's anatomy, if someone's overweight, that's putting them at higher risk of tearing their ACL. If they have a narrow femoral condyle notch, so here, this patella doesn't come off, but if you took off the patella, there's a groove. And so if someone has a narrow groove, that's a contributing factor to an ACL tear. And then also increased joint laxity. So if you're hypermobile in general, I found this was really interesting. So the researchers think there might be some hormones involved in likelihood of tearing ACLs, and they're finding that in women specifically, an ACL tear is more common in the early and late follicular stages of menstruation. Some people might wonder if they're not wearing a knee brace, are they more at risk? And right now the evidence is pretty inconsistent on preventative knee bracing. A risk factor is also if you're just a recreational skier. Recreational skiers tear their ACLs at a much higher rate than professional skiers. And time of day, you are at a much higher risk of getting injured or tearing your ACL after lunch, which we'll talk about more in a little bit. So we've talked about collateral injuries, cruciate injuries. Now we're moving on to tendon injuries or tendinopathies. And so the cruciates and the collaterals are ligaments, and they connect bone to bone. With a tendon, you're connecting muscle to bone. And so most people have heard the word tendinitis. As a physical therapist, we use that word when it's more acute. And itis means you've been doing something a lot one day and the next day it's hurting you. And so a tendinosis is usually what a tendinitis becomes later down the road with that repetitive overloading. This is best treated with PT. How do these tendinopathies happen? It's usually that accumulation of microtrauma that is just exceeding the tendon's ability to heal and remodel at the time. And so you're not really giving it that time to heal. And then the healing doesn't really happen because you're not giving it time. And so it's this cycle of tendinosis. Symptoms of a tendinopathy can be pain, stiffness, loss of strength in that affected area. Common tendons affected in skiing are the Achilles tendon at the back of the ankle and heel, peroneal tendons, which run on the lateral side of your ankle, and your patellar tendon. Okay, so treatment for tendinopathies, usually it's just conservative treatment with physical therapy, which can lead to large improvements in pain and function. And so this is very treatable, especially if someone's motivated. With a tendinopathy, especially a tendinosis, eccentric muscle activity is best to treat those issues because they're more chronic. So eccentric muscle activity is a lengthening of the muscle. So if you take your biceps and you push on it, or you take your biceps, put your arm in flexion, and my muscle doesn't move, that's an isometric movement or an isometric contraction for my biceps. If I'm shortening the biceps muscle, that's concentric, and then eccentric would be if I'm lowering a weight and that muscle is lengthening. Lack of pain does not necessarily mean you're fully healed either, because structural changes in tendons can take up to 24 weeks. So it can be a long process. Okay, so we've scared you enough with ski injuries, but how can we prevent them now? So even though we focus mostly on lower extremity injuries, one of the first and easiest ways to prevent a minor injury from becoming much more serious is wear a helmet. So it's an easy way to prevent a head injury. Make sure you have the proper equipment. So be careful if you're borrowing equipment from your friends where their boots might not be fitting you and their bindings aren't fitting and the ski length is not correct. So make sure your boots are well fitted, your bindings are at the appropriate din, your ski length is appropriate for your height and your skill level. It's really important to learn proper technique. So even if you want to learn trial by fire, probably best to take a ski class or a ski lesson. Recommending the White Pass instructors, they are professionals, so learn from them and it will be well worth your investment to prevent a future injury. And then another big way to prevent injuries is just rest. Injuries happen much more commonly with fatigue, as we talked about after lunch. So just make sure you're taking breaks as needed. And if you're tired, stop. And in a bit, we'll focus on active ways to prevent injuries as well. I wanted to throw in this article because I thought it was really fascinating. And it has a great picture of different widths of skis and how they affect skiing and knee kinematics. And so in this picture, you can see the skier on narrow skis in an athletic ski position. And then the skier on the right is wearing the fat skis or powder skis. And do you see the difference in their knee angle and how much knee valgus is happening? And so as we talked about earlier, Getting my knee back out. Knee valgus is when the knee is bending in. And so normally with a healthy skier and good stance, it's a little bit. And in that powder ski, to get on that edge, it is forcing you into so much more knee valgus, which is putting a lot more strain on those collaterals and cruciates. For injury prevention as well, we focus a lot on proprioceptive skills, which is basically your body's awareness of where it is in space, of its position in space. And so it's combining different sensory input from various afferent receptors. And so your knee is one of the joints that's sending signals to the rest of your body saying, okay, this is how much flexion my knee is in. Where am I? What am I feeling? And studies have shown that poor proprioception is actually one of the biggest risk factors for ACL injury. When people just, their coordination is off and they just don't have great body awareness. But an example of proprioception is being able to sense changing terrain without actually looking at the terrain. So am I skiing on powder? Am I on a groomer? Just feeling that and your body being able to adapt that position. Okay, so we're looking at the different body systems, and this is a summary of how can we look at the different body systems and prevent injury. So regarding the musculoskeletal system, in just a few minutes, we'll talk about some active exercises. With regards to your cardiovascular system, one of the biggest things you can do is just stay active in the off season. Fatigue is such a large player in injury, and so when people haven't done any training, haven't done any fitness for the last 6 months and go back to skiing, it's going to be a lot tougher for them. So make sure you're staying active so your heart and your cardiovascular system is ready. We're just talking about proprioception, so your neuromuscular system, getting that ready. So balance is a great activity, and just practicing things like single leg balance. We'll also get to some, and then also working on compliant surfaces, which we'll talk about some more exercises in just a second. Regarding your psychological health, make sure you're not being pressured by those around you to do things that you don't feel comfortable doing. The way people get hurt as well is when you're doing things that you're not ready for. So make sure you're with a supportive group of people that aren't having you do things that you just don't want to do. And then nutrition, stay hydrated, make sure you're eating, putting good nutrients in your body. But it is surprising how dehydrated people get in the cold. They just don't notice it as much, but make sure you are drinking plenty of water, as well as paying attention to your energy levels, like we talked about, especially after lunchtime. With regards to injury prevention, one of the biggest things too is just proper ski form, working on an appropriate stance. So you want that athletic stance where your hips bent, your knees bent, your ankles are bent equally. They're slightly flexed in that ready position. Your skis are about hip width apart and parallel with each other. So hopefully you're getting out of that snowplow position sooner rather than later. Your hands and weight are forward and your shoulders are over your knees. So you want to avoid riding in that backseat position and get more upright. With regards to proper ski form technique, for your turns, you're rolling from edge to edge. You want to be strong but not stiff with your turns. And then for those who have not progressed yet out of snowplow, try to keep your weight balanced, because if you're putting that much stress on one leg in that valgus position, you're just going to be putting a lot of stress on strain on those cruciates and collaterals. Also, if you're not comfortable, stay on marked trails. If you're learning, avoid obstacles like trees and rocks, and stick to terrain that is comfortable for you. So some of the active prevention exercises to discuss today are double leg squats. And I want you to focus mostly on the position of this athlete. So her weight is evenly distributed, her knees are forward, and in the wrong position, she's in the back seat, her knees are bending in with that valgus position. And so focus on the right form, because if you're training incorrectly, then you're not really setting yourself up for success. We talked about proprioception, so single leg squats can be effective for both proprioception and general strengthening. With a focus on even pelvis, avoiding that significant knee valgus. In the wrong way, you can see her hips are dipped. There's a lot of knee valgus, so be focused on the kinematics. And it's better to do these more shallow with correct kinematics rather than deeper with poor kinematics. Side-to-side skaters are really good. I like to do these, start with people just kind of lunging into the position, and then I get them jumping into the position. But that works a lot on that hip abductor strength. That's really important as well in skiing. And then side plank is great for your core strengthening and your hip abductors. And so there's just making sure your shoulders and hips and knees are in alignment. An improper way to do this would be if your hips were just still too low and you weren't really engaging your hip abductors. But you can either do this with the modifications of your knees straight or your knees bent. So knees bent will be a little bit easier. So that was a lot of information. Thank you all so much for tuning in, and just wanted to open up the floor for any questions you might have. Okay, well, if nobody has any questions, here's a few citations I used, and just really wanted to say thank you for participating in Arbor Health's Wellness Week. And if you all need us for any prehabilitation or rehabilitation, hopefully watch this before your season to avoid injury. But if you do need us, we're here for you.
Great, thank you, Amy. Just wanted to remind everyone that this is going to be, this was recorded, and that this will be up on our website. So please let your friends know, especially those that you know like to ski, because I think this is great information. And check out our website for all the future presentations that are going to be done the rest of this week. We are excited about those as well. Thanks, Amy, very much. And we want to just thank everybody for joining us.
Thank you.
Amy. Very good job. Awesome.